AB 1999 will make numerous common sense changes to veterinary statute, reducing staffing shortages in California shelters and making veterinary care more accessible for everyday pet owners. In 2023, I authored ACR 86, which encouraged the state to address its pet overpopulation crisis by supporting high-volume spay and neuter services and filling critical veterinary staffing gaps with qualified out-of-state professionals. However, these goals remain unmet, in large part because of the state's ongoing veterinary staffing shortage. This deficit is especially felt by animal shelters, of which 25% lack adequate veterinary staffing and 64% cannot meet their animals' basic medical needs. The impacts of this shortage are compounded by a cumbersome statute which further restrict existing staff's limited capacity. For instance, California is one of only 2 states that still require a veterinarian to reestablish the veterinarian-client-patient relationship every time a pet owner seeks treatment for their animal. This means that a veterinarian must examine a pet prior to providing any prescription or recommended course of action, even if they already know the animal and has medical history well enough to provide effective guidance for minor issues over the phone. While this requirement poses an inconvenience for all pet owners, it especially burdens low-income owners who lack the resources to facilitate frequent veterinary visits. Separately from this issue, animals are also suffering under California's excessively broad owner exemption. The exemption lets animal owners perform virtually any medical procedure on their animals, including surgeries. Because most animal owners have not received a veterinary education, they cannot safely perform these sensitive procedures. Anytime they attempt to do so, they put their animals' health, well-being, and life at risk. AB 1999 addresses these issues by creating a retired volunteer status for retired veterinarians and RVTs who wish to provide unpaid voluntary labor to animal shelters and humane societies. It creates a streamlined pathway for out-of-state veterinarians to become licensed shelter veterinarians. Reforming VCPR statute to allow veterinarians to provide care within reestablishing an existing VCPR, clarifying other aspects of veterinary telemedicine statute, and narrowing the owner exemption to exclude surgical procedures. Together, these solutions will help eliminate many of the barriers that prevent countless animals from receiving the care they need and deserve. With me to provide supporting testimony is Judy Mancuso, the founder and president of Social Compassion in Legislation and former Veterinary Medical Board member, and Grant Miller, CVMA Director of Regulatory Affairs.
Thank you. Good morning, everyone. In 2024, my group sponsored Assemblymember Kalra's ACR 86, which called on the VMB and stakeholders to address the pet overpopulation crisis by increasing access to veterinary care and spay and neuter services. AB 1999 is a strong and meaningful response, and as a proud co-sponsor, I want to thank Mr. Kalra, the VMB, MDC, and CVMA for crafting this comprehensive bill. Our state's pet population has exploded, pushing some shelters and rescues beyond the breaking point. Too many Californians have purchased from breeders instead of adopting, and we have seen a surge in backyard breeding. At the same time, access to veterinary care has declined. This is driven by multiple factors, including workforce shortages, mental health challenges within the profession, rising cost, and industry consolidation. As costs rise and access declines, fewer animals are being spayed and neutered, further fueling the crisis. AB 1999 also addresses serious harm occurring under the owned animal exemption. As a former VMB board member, I am aware of cases involving cesarean sections on kitchen tables, amputations in garages, eye surgeries in bedrooms, and ear croppings with household scissors, often resulting in severe suffering or death with no legal accountability. We must close these loopholes to prevent heinous cruelty while also expanding access to care. I will now turn it over to Dr. Grant Miller to walk through how the bill addresses these challenges. Thank you to the chair and the committee for your leadership and to your stellar staff. Thank you. Hi, Eddie.
Thank you very much. Go ahead.
Thanks, folks. Thanks, Judy, for the introduction, and I join her in thanking the staff and especially Assemblymember Kalra for his ongoing dedication to animal-related issues. Again, I'm Dr. Grant Miller from the California Veterinary Medical Association. I am proud to be joined with our coalition co-sponsors, Social Compassion and Legislation, San Diego Humane, and the California Veterinary Medical Board. I was going to fly really close to the sun and do a 2-minute to the minute presentation. We're getting really close to lunch. The Assembly member very succinctly and clearly summarized what this bill is doing. I would like you to take note of the co-sponsors of this bill. For any of you who have had the dubious pleasure of working on animal-related legislation, I think that this bill stands out among many of the others because all of us, all the stakeholders, the major stakeholders are coming together to do one very, very powerful bill that I really am proud to say that I believe we're sticking the landing. And so with that, I would respectfully ask for your aye vote. Thank you.
Thank you very much. Any additional witnesses who want to add on in support of the bill?
Hello, Juliana Tetlow with San Diego Humane Society, proud co-sponsor and strong support.
Thank you.
Nicholas Sackett with Social Compassion and Legislation, doing a courtesy Me Too for Animal Legal Defense Fund. Thank you.
Thank you. Any primary witnesses in opposition to the bill? Anyone who wants to add on in opposition to the bill? Bring it back to colleagues for questions or comments or motions or seconds. Have a motion and a second. Don't see any questions or comments. Assemblymember Calra, who would you like to close?
Respectfully ask for an aye vote.
Well, thank you, Assemblymember Calra. Thank you for bringing this important bill forward. And as the doctor alluded to, I know from experience that keeping consensus on animal bills is often like herding cats. So I commend the author and everybody who's all the sponsors and supporters of the bill for having such a broad co-sponsor coalition behind this measure. This bill will bring much needed reforms to the veterinary space and, more importantly, help animals across California get essential care. Assemblymember Calra, thank you for always looking out for the homies. And I'm happy to support the bill today. Madam Secretary, please call the vote.
On AB 1999, Calra, the motion is due pass to the Committee on Appropriations. Berman?
Aye.
Berman, aye. Johnson? Addis? Aarons? Aye. Aarons, aye. Alanis? Baines? Baines, aye. Bauer-Cahan? Caloza? Chen? El-Hawari? Hadwick? Hadwick, aye. Haney? Haney, aye. Hart? Aye. Hart, aye. Irwin? Irwin, aye. Jackson? Aye. Jackson, aye. Lowenthal? Macedo? Macedo, aye. Huen? Huen, aye. Pellerin?
That bill is out. Congratulations. Thank you very much.